lot of ethnic patients, whether they are African American, Latino American, from all over the world who come in, Middle Eastern, whose major concern with rhinoplasty is that they have thick skin and can they get a real result.
And again, for us, this is one of the areas that's difficult to deal with, especially through a closed rhinoplasty approach. We don't really know of any useful approach that you can do closed where you can get some real management of thick skin and really be able to allow the skin to redrape appropriately and show real definition.
Yeah, through an open approach, our mainstay with this sort of thing is to get a sense of how much fibrofatty tissue there is underlying the skin, so that in an open approach you can basically invert the skin and through a very controlled, safe method remove the fibrofatty tissue while staying clear of the dermal tissue and dermal plexus so that you don't have any real scar tissue develop, and in that way the skin will basically act like it's thinner and contract. Now, that's not a be-all and end-all for everyone.
Yeah, there are some people wherein the skin itself is thick. They have very oily, thick, sebaceous skin. And for those patients, you may not be able to get that type of contraction to the same degree. On the other hand, a lot of patients have this thick layer of fibrofatty tissue underneath the tip that just cushions everything, that hides definition, that provides some projection. And for those patients, we can often create a really dramatic change.
Yeah, so it's really important to meet with surgeons who have a lot of experience with this and understand this in the preoperative setting so that they can give you real expectations, so that they can really tell you what you can really do.
And this really applies to the revision setting too, not necessarily in patients who had thick skin to begin with, but who have a rind of scar tissue that's built up as a result of their previous surgery. Again, through the same open technique, we're able to address that scar tissue in a very aggressive but safe way to really allow the skin to contract again and get back to a nice, healthy, happy contour.